There's been some fascinating work on the presence of mutations in patients that do not have a hematologic malignancy, and work by Jaiswal, Ebert et al. Really led to understanding the presence of mutations and clonal hematopoiesis of indeterminate potential. So patients that evolve from having these particular mutations that then go on to have dysplasia, that then go on to have clonal events that then lead to MDS. And there's specific mutations that those groups went on to identify as being more associated with a higher risk of progression to disease like hematologic malignancies. And they also found that there was an increased risk of cardiovascular disease, early MI, and stroke by twofold. So that work was really seminal in other groups then trying to ask, well, let's look at larger cohorts of patients and really call out, are there patients that had AML as a result? And so work by Desai and another group, Abelson, went on to look at larger cohorts of patients in the 150,000 range and identified patients that were diagnosed with leukemia and went back 10 years before that diagnosis and looked at serial samples of blood to say what happened with the detection of mutations. And they were able to identify differences in patients over that time span in the presence of mutations and the variant allele frequency, the types of mutations, as well as double mutations in specific genes that then predisposed or led to or could be used as identifiers in saying those patients are likely to progress to AML compared to those patients that did not have AML and did not have those mutations. So pretty provocative work, pretty exciting, really allowing us to think more deeply about how can we impact and change that trajectory for patients.